Again, remember one of the categories that you'll be tacked on, the 4 major categories are pre-existing, low property damage, it's only subjective, and it's not medically accepted. So what do we want to make sure to counter the argument of medically accepted? There's 2 things we want to do to counter the argument of medically accepted. Okay, so let's walk through that a little bit. The first thing we want to do is we don't want to use non-medically accepted diagnostics. That's the very first thing you want to do. That's just going to get you in trouble right off the bat. So we want to make sure we use medically diagnostic accepted. Okay, and we talked about the ones that aren't the common chiropractic ones: surface EMG, thermography, neuroclimeter. Those are not medically accepted. Okay. And then the second category is using your medical team. Okay, and so this is the medical team we like. We like pain management, medical radiologist. Pain management is for the initial medications, pain pills, muscle relaxers, anti-inflammatories, trigger point injections, large joint injections, facet injections. Then we like to use the medical radiologist for the reading of our CRMA, preferably. We like to use the neurologist for neurological problems. We like to use the orthopedist for extremity problems, and then the neurosurgeon for spinal disc problems, and the behavioral psychologist for the mild concussion problems. And remember, all we're going to do, that's our team, and we want to ask for a consult. What's your opinion? Any further testing, diagnostics required? Okay? And then remember I said how you get a team. If you just send people to people you haven't created relationships with, that's when they start taking them out from under care and saying bad things. So I said you find these people and you ask them 3 questions. You say, first, you call them up and say, I'm interested in referring you business. So it's all about them first. I'm interested in referring you business. I'd like to come introduce myself first. Only takes about 3 minutes. Don't schedule a meeting. Everybody's busy. Don't try to schedule a lunch. Just you want to come over and introduce yourself. It's only take about 5 minutes. That's it. You don't want to schedule a lunch. And then you're going to ask 3 questions. Number 1, you get there. Hi, I'm so-and-so, so-and-so. Just, I'd like to refer you patients. By the way, I'd like to just ask a couple questions. Number 1, what do you feel about chiropractic? Just an open-ended question. I just want to make sure they don't have bad attitudes against chiropractic. That's all. That's all. Whatever else they say, I don't care. I just don't want them to say anything bad about chiropractic. Number 2, then I'm going to say, I only have 2 criteria to refer you business. Number 1, when I refer you business, you do not take them out from under my care. And then I use the reciprocal to make it look sense. Just like if I had any of your patients, I would never alter your care. Will you agree to that? In other words, you're getting them to play ball and to not hurt you. And if they can't agree to these, you just don't do business with them. You don't refer to them. And the second question you'll say is, when I send patients to you, I also ask that you don't say anything negative about chiropractic. Just like I wouldn't, if I had a patient from you, I would never say anything about your profession. Will you agree to that? That's how easy it is. And I got to tell you, you'd be surprised how many people will not pass those tests. You'll be surprised. I mean, even in front of you, you can tell they're dimming it down a little bit. And I can't tell you how many orthopedists, neurologists, not neurosurgeons. Neurosurgeons are generally pretty good. Pain management's usually good too. Orthopedists are the worst. You know, they're the worst. I can't tell you how many orthopedists I just walked out of their office. I'm like, you're not getting any of my business. Neurologists are good. I found neurologists to be good with chiropractors. So anyway, that's what you do. That's how you get your team. Those are your team members. That's how you interview them, and that's what you do. So when you refer them over there, you don't get them taken out from care and all that. And I tell you what happens. Here's what happens. Because of what you did, here's what always happens. They'll say, if they don't need that service, if they need, whatever test, I have them do the test, whatever, okay? In other words, I'm going to let him be the professional. If I send it to the pain management guy, I'm not going to be interfering with the pain management's opinion. I'm not going to be interfering with the neurosurgeon's opinion. I'm going to use him as a professional, okay? So, but here's what will happen. Like, especially if, like you send them to a neurosurgeon, they don't need surgery. they'll come back and you'll get a note back. They'll say to the patient, I don't think surgery is warranted right now. Continue with chiropractic care. You know how powerful that is? And it supports the case. It creates authority with the case when you have a team and you're using everybody's professional opinion. So just ask for a consult. Like if I send them somewhere, I'll say, let me just get your consult. I want his professional opinion. What would you do given these circumstances relative to your profession? Just ask for the consult. If he wants to prescribe medication, fine. If he thinks they need an MRI, fine. If he thinks they need an NCV, fine. See, I'm going to let him be a professional. He's part of my team. See how that works?